Thank you. Again, thank you all for being here and for your excellent testimony. We've heard about community care providers outside the VA presenting accessibility challenges when CID veterans or others who are non-ambulatory, disabled, or have complex health needs try to get access to those private non-VA facilities. I wonder if you could talk a little bit from your experience, what you've seen or heard, Ms. Bailey and others on the panel.
We were sent to the community to get our care first to see a neurologist. At that point, there was not an on-staff neurologist at our local VA. Thank goodness there are now. We have a fantastic neurologist at our local VA. Unfortunately, they weren't there for us. It did take some time to get put into the schedule to see the neurologist, and we were his first people that he had dealt with ALS. When you're dealing with ALS, you want somebody who has knowledge, not somebody who says, you know, this is the first time I've dealt with that. That was really, really difficult for us. It's scary. It's so scary. We're grateful that he was willing to learn, but the care that was in the community was nothing like the care that we received at the VA. They at least knew what ALS was, and although it was held up by red tape and all of the limitations that they had, it was still far superior to the care that we received. We even had to go out of our VA when he needed his feeding tube done. We had to go to Biloxi, which is several hours away. That's a really difficult drive when you are taking care of somebody living with ALS who can't move their arms and legs. You're the only person who's able to do that for them. And then you have to turn around and drive home the same day. I can't say that the community care in our area would have been much better. Again, lack of knowledge is a huge, huge problem. They don't understand the complex needs of ALS like the VA providers would.
Others?
Yes, in addition to what Ms. Bailey has just said, that a lot of the community facilities don't have the adequate amount of wheelchair space when you go in there, or the proper equipment to move an individual in a wheelchair over to the exam tables, or even give them a good x-rayer. So that we run into that issue all the time.
I want to ask about mental health. I have a bill, it's called the BRAVE Act, which includes a provision requiring the VA to establish a pilot program to ensure VA residential rehabilitation treatment programs. These are, in effect, inpatient residential treatment, including for mental health. Maybe you can comment on the need for both inpatient and other kinds of mental health treatment programs.
As I mentioned in my testimony, when you're diagnosed with ALS as a veteran, your suicidal ideation risk goes up tremendously. Mental health, while it is addressed, typically there's a questionnaire or they're asking several questions to kind of assess how you're doing. I think there is a bigger need to address the mental health needs of veterans with spinal cord injury and disorder, especially in ALS. When you're given a terminal diagnosis, it changes your entire outlook on the world. My stepdad wanted to take his life because it became too much for him, and he didn't, and I'm thankful for that. But I wish that there would have been more of a focus on mental health. I wish that he had had somebody like my friend Dr. Mary Porter had that would have encouraged him to try new things and to see that he could live with ALS and you're not dying of ALS. I think that's a really important thing that needs to be addressed in the mental health area for ALS.
Thank you. Any others? Thank you. Thanks, Mr. Chairman.
Senator